small group discussion, which is important component of non-lecture teaching, which consists of 138 hours in pharmacology. Some of them would be in the form of small group discussions, and this small group learning, its components, its types will be discussed by Dr. Princy Lewis, and I'm sure we all will be benefited from it. Dr. Princy, madam, please.
Yeah. Thank you, sir. Thank you, sir. Uh, thank you one and all for being assembled here today again for a session in CBME Pharmacology. And now we go on to one of the other sessions. Since our inception that we have initiated, we went through various aspects. Now we go into one common thing. Often it is written, as sir has already said, that there are 138 small group discussions. So my topic is small group learning, within which comes small group discussion. Okay, and this is one of our major teaching learning methods because 138 hours has been given by the MCI for it. So let us see what we mean by this. So the first aspect I would like to go is we have to be on the track, and to be on the track, we have to have our specific learning objectives. And the specific learning objective for this session would be that you shall be able to describe the need for small group learning and to compare the various methods to achieve this. If you see a class of like this, so many, you have 100 students, you have 150 students, some of us have 250 students. It's like an ocean of students. How does the teacher get to them? Is the learning complete here? Is this a right way? You see the different kinds of students. Is there homogeneity? They may be of a similar age group. The backgrounds they come from, their ways of learning, their characteristic methods of learning. Are they audiovisual? Are they kinesthetic? And what is their prior knowledge? All these would be different here. And look at this class. Would you learn better from here or from this class? Here we have a smaller group and the teacher has her eye on every student. And this is another method. Here also you could get the attention of your teacher and the teacher could address your problems, but the best would be a teacher who's all for yourself. This is ideal and this is utopia, which cannot happen, right? But this would be the ideal thing where a teacher is exclusively for you and knowing your lacunae, they would be able to teach. So small group learning, this is the thought of Vygotsky. I don't know how to pronounce his name. Gotsky, Piaget, and Brunner. They have described small group learning is an educational approach that focuses on individual learning within a small group. This is how they have started it, and they have said it is also a part of team-based learning. It is a type of cooperative learning. Now, a little bit of cooperative learning is a type of learning wherein there is theoretical aspects mixed with also the work learning experience. That is actually meant as cooperative learning. And also, you could also take it as a peer learning. So it's a small group of same level students. So what we should concentrate in this is the learning climate. The learning climate and the organized learning that should be occurring. So these are the two things that we are considering when we are doing small group learning. As we see, it is individualized, learning is appreciated. And we see it as a team-based approach, or a small group is considered as a team. It is also kind of a cooperative learning where they teach each other. There is an interdependence, and there is peer learning. People of your same educational goal, they are learning together. That's why it is peer learning. And we are concentrating on the learning climate, and that is the engaging environment that is there. When you saw that very large classroom, it's suffocating. You cannot ask your problems. You don't know. You cannot ask the doubts, and there is no cohesiveness. There's no oneness with the teacher. What the teacher is telling. So that is the reason why we have to have a engaging learning environment where one person is not at a higher level, but all are sitting together at the same level in a round group, or the chairs are arranged in a circle so that each one is considered. That's called as engaging environment, and that is the learning climate that we should induce. And another learning climate that should be induced is for opening up of the students and with the facilitator. Organized learning is there is a whole, it's just not given to the students to do as they please. There is a organized systematic learning that should be occurring. So this is the basis that should be there. Now, why do we need to have the foundation for small group learning? Comes from the fact that in various studies, in fact, there were 37 studies taken as a meta-analysis, and they had found that active learning occurs with small group learning. So everyone is aware that active learning is necessary so that it is relevant and you do not forget. And this kind of learning is also meaningful and a type of deep learning. That's why you can remember all the aspects about this kind of learning. And to some extent, it is a type of experiential learning. So this is the basic foundation of small group learning. This is why we have small group learning. So what are the perks that you get because of doing small group learning? The perks by default that we have is we have development. The students undergoing small group learning, they will go develop communication skills. They will develop team working skills. And mind you, this team working skills is necessary because you and I are working as a healthcare team. Now, you and I are born to our parents. Could we choose our parents? No. So also our healthcare team, often it is not possible for us to choose. We have to live and work with our units and be the healthcare team provider. So team working is learned right in the beginning. So this is another aspect. An aspect of presentation skills. This also develops when you do SDL. It also enhances your debating skills because you are communicating and you have to advocate certain points. So we have debating skills coming through, and you are also developing and building interpersonal relationships between students, other students, between your student and teacher, and that gives you a better level of understanding, and in future also your respect to other persons in the team. Maybe it is your whole institution of your institution. You may have good doctors, good nurses, but the attenders who are shifting the patient from one to another, if they were to take a 10 rupee note, I mean the whole institution's reputation gets a dent, right? So we have to value interpersonal relationships, and that is what is also taught. By default, these are the advantages or the perks that come out from small group learning. It helps us to develop cohesiveness. And as a healthcare team, we have to be together in it. So developing cohesiveness. A sense of trust is also developed because I have to rely on someone. We have to live on trust. So a sense of trust is developed, and also we celebrate the differences. Celebrating differences is also another thing. We hear varied opinions and we come to a consensus. All this happens because of the celebration of differences. Another aspect that we should see is acceptance of differing opinions. we see when we come now, like small group learning, I'm not too keen on small group learning. So you would have somebody who is telling it is not good, others who are saying yes, it is the best method, and you get varied opinions. But when we sit together, it is all the varied opinions should be taken, and then you come down to a consensus on it. So these are the perks that comes out of small group learning. Now, I have written some numbers here. These are not just random numbers. When we say small, how small is small? 30. Like in medical education, most of us I have seen are in medical education, and we conduct a workshop, we call it, we close it at 30 or 25, right? And then another magic number is 10. It's a very nice number. So for small group, we say 10, or we say 6 to 8 is a good number. In fact, there is a study done, and small group is ideal if it is 5, it is written, and 3 is also a good number, but 5 has been proven in some studies have proven. But now you and I have to use small group learning within our second year of professional year of MBBS. And how will we choose? 10 is a good number, and MCI expects us to do, but I think with the number of staff and the institution that you're in, maybe you will take it as a 20 to 25 or 30, right? So this is the number that we are looking on. So when we see small group learning, it dwells on these 3 domains. We are accessing the intellectual, the emotional, and the social domain. These are the basic domains that we are touching when we are taking small group learning. When we do SGL, students are working together to achieve the common, they are all passing and reaching the same educational objective. So now you see the onus is on the student to study. He has to search for an answer. He is responsible for his own learning. So that responsibility, usually students are coming to class and sitting there in front of us as if they're doing us a favor, right? So this onus and responsibility is of the student, and it is built into them when we do SGL. Now, small group discussion is the word that is used in our CBME, which the MCI has given for us. If you see the teaching learning methodology, it is written lecture. Many places you see lecture, a comma, small group discussion. Lecture, comma, small group discussion, many places. And there are DOAP, and there is skill station, all these are there. So I specifically took out small group discussion as a definition. It allows a presenter to put forth an idea or a thought of a topic, and this is presented to the group and they will answer back. So these are, this is the meaning of SGD or small group discussions, which we will have to do it. This follows, SGDs occur on democratic guidelines. They follow democratic guidelines, and everyone's contribution of ideas is accepted, and all of us have to be open-minded to accept these thoughts, ideas. So that is the inlay work about small group discussion. Now, why you want to have small group learning? And as you can see, the MCI has put only 80 lectures, and they have put 138 small group discussions using small group learning techniques, and also they have put SDL. I will leave self-directed learning for another time. We will park it until we come to the session on self-directed learning. We'll have a separate session. So when we see the need for small group learning, it is dwelling on the fact that we as human beings, it's our human basic tendency to be curious. So let us use that curiosity as the basic foundation for our learning. Also, small groups tend to congregate in one place and they discuss. This happens even otherwise. Even if you don't make a formal small group. We have a group of people who are like-minded, and they will come and congregate and they will discuss. So these are the basic things that are making the need for small group learning essential. Another aspect is it is in information-based discussion. Also, the small group learning focuses on facts, opinions, and also feelings, ethical aspects, attitudes, all these come in when we are talking about. So facts is the main, and also opinions and feelings come through. Also, there is we are looking into concept exploration. Moreover, there is analysis of factual information. You're dealing with facts and you're analyzing how much of this is necessary, not necessary, can it be adopted, not. So there is analysis of factual information, and it develops an open mind that helps us in our accepting. And there is awareness of the variety of opinions about a particular thing. We talked about CBME. Oh, why this new curriculum? And we have a variety of opinions. Okay, next we come to the fact of the ability to reach a consensus. So the small group discusses and comes to a consensus. So maybe my opinion, my thought about it was wrong, but now I have changed my mind and I have listened to others' opinion, and then I realize there is something wrong. And so I take my step back and I become acceptable to this new, say, CBME, or say whatever other topic it would be. So we are coming together, although we had differing views, we are coming down to a consensus. It's not easy because all of us are sitting on a high horse. They say, I have caught a two in a bush, like that. We have sitting on a high horse, so we hardly change our opinions, and we are not consistent with the facts, and that's why coming to a consensus is a difficult point. That was the need of small group learning. What are the advantages of small group learning? So now those were the perks. Those are additional things that we get when we do. That was what I had told earlier. Now let us go through the advantages of small group learning. So in this, we can actually go into problem solving. There is presentation skills, yes, opportunity to compare the learning. So you are amongst peers, people like you with the same objective. You see him studying a little more. You see him looking and referring dash books. So there is a comparison, and there is a understanding that, oh, I should be doing like that, So that is the opportunity to compare learning. That is also a motivation, that sets you on the track for learning. Also, communication skill is developed, yes. And then we had also talked about this. There is interpersonal dynamics, are group dynamics, interpersonal dynamics. These are also enhanced, and all the rough edges on you would be toned off by the time you are done with small group learning, and so that when you are an INJ, our students will be well, and appreciating differences, appreciating differing opinions, and not just taking offense, and coming to a conclusion, advocating their choiced opinion, and persuasion techniques. All these things come through. Interdependence. We are not wholesome. We are interdependent on each other. I am not all in all of everything. So this interdependence is also a good thing. Now, don't think it's a negativity. It's not a disadvantage. It's an advantage, because we have to tend to rely on someone. You are not an island. A man is not an island, it is said. We are a social being. So together we are interdependent. Also, we have a common goal. So the group of students that are there, they have a common educational objective, a common goal to achieve, and they go towards that. Now, a good thing is a person who is individually learning, he would have to find the resources for all this. But here there is division of labor. When you have a small group of 6 to 8 or 10, one will find one aspect, another will find this aspect, this person will go and do the other aspect. So ultimately, because of the division of labor, everyone gets all the material without having to labor too much. That's why division of labor, the resources will be got from. Otherwise, you would have to spend all your time in getting the various aspects of resources, etc., what you need to learn. Then there is an aspect of collaboration, and there is the sense of responsibility. So these are the advantages when we go into small group learning as opposed to large group learning. Coming to the disadvantages. Disadvantages of our small group learning. Are there disadvantages? Of course. So let's go through them. Sometimes, although we have set the SLOs, in the discussion, it may go tangential and you may lose sight of the SLOs. Sometimes there is reduced learning responsibility. Like if the group as a whole is doing well, although I am not working too hard, but because the group is good as a whole, I get that. That is called as the free rider effect. So there is some sort of reduced responsibility, but technically it is, you have seen in the foundation, it is also giving you the onus and responsibility of learning. But sometimes this can be. In fact, if you see in Australia, the elementary education, when the students are in achieving a good percentile rather, they are put into they can go into a good school. So once you get into that good school, their overall marks is taken of the group of students as a whole. So they will be at a higher percentile, although you're not doing as well, So these are the drawbacks that we see. Friends, when we talk about medical education and you're talking about small group learning and all, these are not just things that are coming from just medical education. It's coming from education per se. Education is per se, elementary, bachelor degrees, all these, and from business. There is one I have given from Journal of Teaching in Business. Okay, so all these teaching funders are the same. So don't hesitate that it's not medical education. No, all these funders come from these aspects. So, so I was telling you about the free rider effect. Next, I will take you through to the another aspect that comes is the reduced motivation to learn, because I told you that as a positive point that they are more motivated to learn, but sometimes some the spilled on glory effect, they feel that they are already enough and they don't want to learn more because they are with the group. So that free rider effect. And another aspect that we see is in the group, some people have higher capabilities and skills, and that spillover comes on, and that is also called as social loafing. So although I am a conscientious hardworking person, I may tend to have this social loafing. These are terms that are told that can be seen. So that is social loafing, free rider effect, and of course there are logistic difficulties. I know you and I will crib when CBME came. How are we? We need more staff, more place, infrastructural, small rooms, engaging rooms so that we can conduct SGD. These are all our logistic difficulties with there. But notwithstanding this, we should be on to small group learning. It is mandatory for us to do. A word of caution. And what is that with small group learning? Mind you, we are handling students with different levels of learning, and we are looking at a diverse group of students. Now, having this in mind, we should start when you're organizing an STL, these are the points that should come to your mind. So how do you organize a small group learning? So which type I'm not telling, but in general, what would you have to do? You would have to start allotting date, allotting the staff for it, look for the location, find the SLOs which you are going to put for, and you will have to start the briefing process. Then you have to do the process of small group learning, and there would be a debriefing, and there is you should inform prior to the students and to the staff necessary. All these logistic problems are there in organizing. In fact, today is the day of digitalization, and you see many of the teachers are using online technologies that can help you to do this in a easy way, and they use WebPA, WEBPA. They use these kind of techniques for organizing and doing these kind of things. So the whole principle of small group learning comes from the principle of constructivism. Now, there are many isms when you see in the philosophy, and from that we have taken out constructivism as a standard basis upon which small group learning is done. If you see in construction, if you give a support and you give a framework, isn't it easier to construct a building or something, right? Similarly, if you give the framework, the mental model, your learners can begin to uh, uh, arrange and organize their knowledge in a meaningful manner. So this is the basis for uh, putting up a framework. So that is called as constructivism. Now we see the role of the teacher in a small group learning situation. So the teacher is the resource person, the expert, but when you are a small group learning, you are more of a facilitator than the expert resource person. Your duty does not end at just conducting the small group learning. You would have to be, as a teacher, given information as and when necessary. You ask, you have to prepare. There's a lot of work for us to do. It's not that we just lean back and do nothing. We have set the SLO, we have to ask and prepare the purposeful questions that should be asked, maintain the group dynamics, and see that the learning objective is attained. And all that during the time that you're doing assessing and evaluation of the group. So this role of a teacher is very, very important. But yes, we have to be facilitator, not just one-sided flow of info. We are allowing them to pick up. If you find your students, the group is going off tangentially into another area, and that is not what it should be, you should bring them back. But it's like a shepherd, the sheepdog. Yeah, the sheepdogs, there is a whole herd of sheep, and these one or two dogs, they will herd them to the sheep pen, and they do that by, when they go off the side, they run that side and then put them back in so that they don't get lost and away from the main herd. So you and I have to be as facilitators here, and we have to be very innovative and very inspiring to maintain this role as a teacher of a small group. So we see there are many strategies available. Now, these are the various strategies. I'm sure most of you all have come to know about it and have following too, but let's go through them one by one. Mini lecture is a small lecture that is put to a group that builds on the prior knowledge that may be needed before going on into a case-based learning. Depending on that scenario, you need to give them some more information. Then you may have to present a verbal presentation may be made, and that is a mini lecture. Then there are rotating trio. You have, these are all, small methods by which you do, but I'll come to them. But for the completion, I've given you the whole list, rotating trios. So 3, you mark them as 0, 1, and 2. and the ones and the twos rotate, go to the other in a clockwise manner, so that you have at all times 0% will stay at the in that trio, will remain there, but the others keep rotating, so that each time you have a different 3 students sitting together. That is rotating trio. That's just a manner of doing it. Fishbowl, you have heard it all. One is the observer group, one is the action group, or the one who is making the discussion or doing the role play. Another method is tutorial. Now, this is one that we would use many. In fact, when we saw the timetable, Dr. Kilnani had told us that it is nice to have tutorials, and the whole basis of teaching and learning is repeat, repeat, repeat. Tell what you are going to tell them what you are, tell them, and then you have to tell them what you have told. So 3 times repeat, repeat, repeat. That's what is happening. So you're told in the lecture, maybe you have a small group teaching, you may have tutorial, you may be again repeating it in the practical or some other ways. Then practicals, of course, demonstrations. Also, we use small practical demonstrations. Yes. Then problem-based learning. Here we give a trigger, and we can have a student, the group of students are given a trigger, therapy for a case of fever of 5 days, acute intermittent high fever. That trigger can be given, and each group can take it. Now, mind you, the learning objective in problem-based learning is set, it is student-centric. So it is set by the student. So you have just given the trigger, but this is a nice way for them to go into self-inquiry mode and find out about it. So each group will come and present, and then you see you have them presenting, say about malaria, say about UTI, and so we have various groups giving different aspects of what they would like to do. Sometimes it may even come up as a, they may take it up, 2 groups may take the same topic. So, but that is okay. So that is problem-based learning. So we could have a PBL. Another is case-based learning. Case-based learning is here the trigger is a type of, it's a variant of the problem-based learning where the trigger is a case scenario. Now, who's bringing the case scenario? The teacher. So what is the difference between PBL and CBL? Here the teacher is setting the SLO, not the student, right? So that's one slight difference that we see between PBL and CBL. So the case scenario is given depending upon the prior knowledge of the student, and we are building on the prior knowledge, and we are giving them the case that gives them a real-time situation, how to handle. Tomorrow, how they are supposed to handle. So this becomes relevant, and this learning is, this is the best type of adult learning, and that stimulates them to learn and be motivated to learn. So these are few. Again, we have some more. There are crossover groups. That is, you have one group and then you cross over to there. You have 2, 3 going on. Then in a large class, you can put think, pair, and share. This also can be done. Also, you have snowballing or pyramid. That is, first you discuss with 2, then 2 becomes 4, and 4 becomes 8, and at last you're discussing with the whole class. That's pyramid or snowballing. Another is action learning sets. Oh, sorry, there's a spelling mistake there. Action learning sets. Okay. In an action learning set, it's done in schools often, so about a topic, like say malaria, you could give them aspect of one group will be looking at the slide of the schizont, etc. Then you could have another one, the clinical features, and another aspect would be the part of what drugs are to be given. So like this, you could have action learning sets, and another will be looking in the computer or a laptop that is kept aside. So that group, now all these groups rotate, so they get all the aspects, and that is called as an action learning set. If you see 8th standard, 8th grade students, they are doing this kind of things. In fact, I really would advise you to look at what your children are being taught in their schools. They are using all these techniques which you and I are using, and they are using it to the very good benefit. Yeah. So that's one another way of looking at things. So we have action learning sets. Next is a forum. A forum is a group where there is a question answer session, quite like your tutorial. Okay, but the questions come not only from the teacher, it comes from the group itself, and that is answered by the group and people from the group itself. So that is forum, and that is also called as a small group discussion. So another aspect is panel discussion, where there are experts who will discuss on various aspects, and a kind of personalized how they met the challenges in all these will be discussed. So that is panel discussion. And symposium is on a single theme, various aspects are presented. That is a symposium. So we can use panel discussion and symposium. And if you would remember, Dr. Rege and Dr. Kilnani had mentioned to you in integrated learning from temporal, coordination, sharing, correlation, and nesting. You know, for nesting, you could get a physician, a cardiac surgeon, or a cardiologist to come for your cardiac failure. You know, and you could have a nesting session. So they are depending upon the integration, etc. So that is a good way of bringing down how we use these techniques. Okay. Next, after symposium, we have here mind mapping and the Delphi technique. So Delphi technique is a method by which you bring out many persons in different geographical areas. You can get their collective thoughts on a particular matter. That is called the Delphi technique. And there is also mind mapping. That is a method by which, you know, instead of note taking, you have a concept mapping being done so that the whole notes are taken down in a nice pictorial. On one sheet, you get all with arrows, you know, with bubbles here and interconnected. So it gives a concise manner how to remember, and that will be relevant. Then we have bus groups. Then we have bus groups is in the whole class. You can suddenly divide the class into the whole 100 or 150 students. You can give them, make them into small groups and give a special task of the whole subject. Say after you finish antihypertensive, one group you can give ACE inhibitors, another group some diuretics, some calcium channel blockers, you know, and then you can get them. So you can have a bus group. Then we can have brainstorming. Now, brainstorming or idea storming, as it is called, you can have individually, you know, I have a problem. What do I do? You can brainstorm yourself, but one brain is not as good as many brains together, isn't it? So let's do collective idea storming. That would be a better way. And these are done, and these are commonly done to handle issues like how now the COVID has come, and you know we have brainstorming with the infectious department and the health department along with others, and these are things that can be, it's a short term, very focused, and very at the end of it you come out with an outcome, and the outcome of this can also be evaluated. So brainstorming sessions are very good. And of course workshops, these are things that you and I are doing a lot of times, and we could have workshops and we have seminars. And now in the digitalized area and in COVID times, we are having a spurt of webinars. Not just this webinar, this is also a webinar. Seminar is group discussion. You can have your students, like say it is antihypertensive, you know, in a repeat you could have them do various aspects of antihypertensive therapy. You know, on cardiovascular seminar you could have 5-6 students, divide the topic, give them 10 minutes each, and they'll come and prepare. And you know what, when the students, I mean, we cannot do it for the whole class of 100 to take seminar, but we ask volunteering them and they come forward and they have answered that at the end of the university exam, this question was part of my part which I had read when I had to present this seminar, and this is like water to me. I can write it anytime. I don't need to read it. They become master of the subject. If you have to speak for 10 minutes, you would be reading some 40, 50 hours, isn't it? And so much material you would read more than above, because you have to be thoroughly prepared. So although in seminar, our participants, rest of them may not read, the student who has prepared the seminar has thoroughly prepared and is ready. So this is a very good method, student seminars. And you could have various aspects. We do in student seminars, we have, say, take a case of malaria. You start from all the aspects can be taken, like a integrated teaching also could be done. So the students of the second MBBS will be horizontally and vertically, they are taking care of integrated seminars. So this is one way which we are commonly doing, isn't it? So that is seminars, and nowadays webinars, yes, that is e-learning, right? And then debate. You can have a topic given, and multiple presentations by for and against the topic can be given, and this is including when we are teaching our students to be medical graduate, Indian medical graduate, we are not just looking for them to be just they have to mouth and they have to advocate what they want to be done for the country in the state of COVID, or in whatever the state that they are going to be tomorrow. They have to be having advocacy. They have to speak out. These debating skills, etc., help them into persuasion and advocacy. So that was one set. This is the other set. And then here we have this jigsaw. It's a really nice teaching technique that is taken, and it's beautifully, it's not any difficult. It's very easy to do the jigsaw technique. And from the whole class of 150 or 100, you can divide them into groups. And then from this home groups of, say, green color, yellow color, red color, you will take out one of them and you make them the expert group. So they grow to a particular group, and then they come back and teach the 4 different aspects to these. Here we have 5 groups. So 5 students will go and get from the expert, they will learn, and then they come back and teach their groups. So this jigsaw technique is also a method for evaluation also. So also problem-based learning, so also case scenario-based learning, where there is a common mark for the group learning, how well it has occurred, as well as individual, right? So jigsaw also can be evaluated. So these were all the various methods that we had. Now you can see all of these methods, and we can try to use them into what we are supposed to be doing. So we have been given small group discussions, and many of the, if you see the CBME curriculum for pharmacology, you see many of them is being asked for doing SGD along with lecture. So which ones, how would you want to do your SGDs? Definitely you will take tutorials. Of course, there are some practicals and demos that are there. And also you can use any one of these techniques to improve, like panel discussions, seminars. They have advocated us to use seminars, and you can be innovative and inspiring and use any others too. So that's how it is. So I have almost finished what I have wanted to do, and now it is time for y'all to answer and tell me how it is. Now we are coming to the hands-on part. So I would like you all, one of you should raise your hand and then tell me what way you would like to take this pharmacology competency 1.23. It is written that to discuss the process and mechanism of drug addiction. And here it has been given, teaching methodology to be used as lecture, small group discussion. So can we have a show of hands? How would you like to do the small group discussion here?
Please raise your hands.
How would you like to do it?
I don't see any hand. You can write in the chat box also.
Yeah, but someone do please volunteer. It's not that we are not wrong or we are not right, but you should try.
Dr. Manjula, yes, now there are hands. Now there are hands.
Oh,
Yes.
that is it. Yeah, I was wondering. Yes, go ahead.
Dr.
Dr.
Dimple
Mehta.
Mehta. Please unmute yourself.
Good evening. Yes. Good evening, sir. Good evening, madam. I
Good
think so. This is the this competency we have to take along with forensic medicine as an
Yes.
integrated.
Good.
Yeah. We can divide them in groups, and we can
No.
make them
1
to
minute.
play a role.
Dimple, 1 minute.
Sure.
It is integrated with psychiatry.
Okay. Okay, madam.
Psychiatry. Yeah. Go on.
Okay. Can we start with the role play of
Yeah. Good. Good.
And different drugs which can well, people can have addiction about tobacco or alcohol or even marijuana and all, so we can have the role play of side effect. Role play showing the I mean negativity of this type of addiction, like family problems.
Would you like to tell about the reward pathway and how
Yes,
the person got into it? This is a
Yes,
nice way.
addiction.
Yeah.
Yes, madam.
Yeah.
Reward pathway can be taught first, then the basis of getting addicted.
Yeah.
That can be understood. That can be made understood first.
Yeah.
So we can teach them via small group in.
Thank you, Dr. Dimple. Does anyone have any other way of using a small group learning method for this? Integration
Dr.
with
Veena Nayak.
Yes.
Nayak, please unmute yourself.
Yes, sir. So first, we could have a brainstorming, maybe for half an hour, on what is dependence, what is addiction, what is withdrawal, what is reward pathway, and this will be can be followed by small group discussions where we give cases to each group. The different group can have different cases. It could be a case on withdrawal, alcohol withdrawal. It could be a case on opioid addiction. It could be a case on dependence. So different kinds of cases can be given to different groups, and then we have a discussion after that, and all these cases can then be shared with all the other groups through different e-learning portals, or it could be even after the class, and then we give them a self-directed learning assignment that a list of various drugs of abuse that are available, that are happening in the campus or outside in the society, and how are they harmful.
Very good.
Hello.
Yes.
Yes.
Sir.
Yes, sir.
Actually, the competency is discuss the process and mechanism of drug addiction. So, how I was just wondering how role play will be helpful. Addiction is not
how they got into process of addiction.
So this has to be small group discussion, but mostly cognitive domain. what I understand is. And second thing is that in a batch of 100 students, 2 hour practical can be assigned for small group discussions and sessions, and the logistics would be divide the batch into 50 each. Half goes to microbiology, half comes to pharmacology, and of this half, you can make 3, 4, or 5 subgroups, divisions, depending on the availability of teaching faculty. Only then small group discussions or learning can be possible. In a batch of 100 or 150 or 250, it is simply not possible to divide them. Larger number, it will not serve the purpose. Now, this is what I personally feel it should be done. A number of topics are there which can be discussed: mechanism of drug action, anti-emetic drugs, lipids, use of bronchodilators or aminophylline and breathlessness, differentiating LVF versus asthma, morphine uses, absorption, distribution, routes of administration, drug addiction. But now this type of the competency where process and mechanism is to be depicted. I think tutorial, demonstration, some sort of that would be a better option. The only thing is how many small groups will either it has to be repeated many times or larger number of faculty members are involved, and they should also have a pre-demonstration session that these are the components which they will be teaching.
Yeah. Yes, sir. Let us go to the next one. The next, that is the pharmacology competency 1.32. To describe the mechanism of action, the doses, the types, and the indications and contraindications for drugs used in bronchial asthma and COPD. So here also they have given lecture and small group discussion, and in the integration they have said integrated with respiratory medicine. So how would you like to go about doing small group discussion here?
Dr. Manjunath.
Good evening, all. So, ma'am, with the prior information, the students can be given different topics to be presented as seminar. And at the end of the seminar, the experts like the pharmacology and the pulmonary medicine professors can give their final inputs to the topic.
Okay, that's nice. Very good. Anybody else has another way of doing this small group discussion?
Dr. Chandrasekhar. Dr. Surabhi Gupta.
Good evening, everyone. My suggestions are that after taking a lecture on bronchial asthma in a small group, we can go for a jigsaw puzzle. We can divide the students. One group will study about mechanism of action, another about the types of asthma, then doses, name of the drugs and doses, indication. One group about indications. So there will be various expert group, and then they will go to their home group to teach other students about the various aspects of bronchial asthma and COPD.
So you've used a novel technique, very simplified manner. Very good.
Thank you.
Dr. Monica Jain. Yes, Dr. Monica. Please unmute yourself. Then on chat also there are a large number of questions.
Yes.
For 1.32 interactive lecture followed by STD as follows: think, pair, share, brainstorming, hands-on with use of inhaler. Dr. Sharon Sonia. Then
Nice.
SGL into 3-4 groups: causes, signs and symptoms, and role of society in the management. Kumar Bhardwaj.
Very nice.
Then Dr. Devashish Ray has asked, can you repeat the difference between PBL and CBL?
Okay. I shall. I shall do it now before I go into the next competency. So problem-based learning is the matter of small groups. They have a the whole class will be divided into groups and there is a briefing session and they are given a trigger. And the trigger can be anything, a statement saying, say, what example I took off my head was acute intermittent fever, acute intermittent high fever, and for 5 days, and how can it, so that was the trigger. So that is, each group can take it in any specific learning objective as they please. They can set the student centric and it is student sets the specific learning objective. Like they want to talk about urinary tract infection, or they want to talk about malaria, or they want to talk about scrub typhus. Okay, maybe. Another thing about case-based learning, case is the trigger. So case-based learning is a type of problem-based learning, but the trigger here is a case scenario. Now, who decides, who sets the case scenario? It is the teacher selects the case scenario and that is given to the students. How does the teacher set the case scenario? It is depending upon the topics learned, what is their prior knowledge on the subject, and then accordingly the case scenario is given so that they can delve more into understanding and learning about this topic. So that's the one difference. Case usually all these methods are mainly student centric. So often it is the PBL, it is the SLOs made by the student, but in CBL, although it is a type of PBL, it is made by the teacher. It is set by the teacher. Yeah, that was the difference I did say. Yeah. So friends, shall we go to the next competency?
Hello, can I
Yes,
share a screen? I have got a table of differences between PBL and CBL.
Yes,
If
sir.
all
Please
can,
go ahead, sir.
Okay.
but I have to share the screen.
Please, sir. Go ahead.
Okay.
Dr. Bedi will do the need.
Please permit me to share, yes.
Definitely, sir.
Yes.
Okay, now is it visible?
It's coming.
No,
It's
sir.
coming.
Yes.
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 Now.
Yeah, actually, it was already made by me, not today I have made it. So I thought, let me share with all so that all are benefited. The problem-based learning, the goal is to learn problem solving. Okay? Information gathering, clinical reasoning, collaboration. Focus is usually how to go about solving the problem which is presented, not as much what the content of the problem is. So therefore, this is a process learning activity. The case-based learning, student can learn about the clinical cases, about diagnosis, about management of a problem which is presented. Usually problem is a clinical problem or a case problem. And differences in inquiry. Open inquiry approach is used in problem-based learning, and guided inquiry approach means here the role of tutor is different. Guided inquiry approach is used. The third is focus. Problem solving is the main learning objective. Where here there is one has to apply basic knowledge to solve the specific problem of that case of management as pertains to that something. Now, can I go up? How do I go up? Yes. Advanced study
So I
problem-based learning. The student has little advanced preparation. That means prior preparation is very little. Whereas in case-based study, both the student and the faculty prepare in the advance, and there is a guidance to the discussion so that important learning points are covered. and therefore deeper learning can occur with case-based study. The learner's role is active participation, whereas in case-based study it is interactive, expected to participate, and since he or she has done advanced preparation, many questions can be asked by her or him to clarify the doubts about that case. And role of teacher is he is information provider whenever information is sought, does not interfere with the student's interest even if not directly applied to the case. Whereas in the case-based study, he provides information, cases, he is expected to guide the discussion, keep discussion on the track without allowing much tangential discussion, ensures that correct answers are known. Final outcome of a problem-based is process is the outcome, whereas in the case-based, outcomes are measurable only. So this is what I could collect from the literature. Hope it clarifies so many doubts.
Can I add something?
Yes,
Because
ma'am.
Yes, please.
yeah, because sir, there is some problem maybe there in the concepts. See, problem-based learning is a curricular approach. It is, though we are using in India a hybrid of problem-based learning, means we take the elements in that. As sir rightly said, there is an active participation by the learner. So we use a hybrid problem-based learning, which aims at that problem solving. But in reality, wherever the curriculum is a problem-based learning curriculum, you give the problem. The problem can be 2 or 3 lines. Means, for example, if the student is of first year or something, then usually there are different blocks. Whenever you have a problem-based learning, it has to be an integrated curriculum, and there are many blocks are there at different levels. So, suppose in the first year, the student is learning, say, 6, 7 subjects in an integrated manner. It could be just the XYZ comes to the OPD with hemoglobin level of 5.5 gram per se. Now, it can be as simple as that. Then the students have to think what is meant by hemoglobin. They raise all the queries related to that. Whether that 5.5 gram is normal, then what are the normal levels, or whether it is something different, then what is to be done in such case. And they go back. There are usually 2 sessions or sometimes more. But in the first sessions, all those issues which are raised by the students are listed down by one of the person from the group, and the teacher is just a facilitator. The students will go back, they will read the literature, they will discuss maybe with their facilitator, but no one gives the ready-made information to them. That is why it is active learning. And next time they will come and everyone will give the inputs, and if they are going in a wrong direction, then the teacher will intervene. The same problem can go to the next block or the next year, this thing, where you are going towards the management. But it is basically the problem is a learning stimulus for the student. No one attempts to solve that problem. It is just to get the cues. Whereas when we are using it as a hybrid, you can use it in a different ways, as sir has shown. And in some of the medical colleges in India, we do have this hybrid problem-based learning, because the basic thing is it stimulates the active learning by the students. So that's why you have to differentiate between the problem-based learning and problem-solving learning. These are the 2 different aspects. Yeah. Thank you.
Yeah.
Thank you.
That was very well said. In fact, in Malaysia, the IMU University, they have the problem-based curriculum. And there the students are going from one to another. They look very cool. They look very relaxed, but they are learning. Theirs is not like our kind where you're attending classes, you see, but they are learning. Good.
And they cover a very small part of the curriculum. They will train the students if the case problem comes, how to go about that. Because in reality, as a physician, we are always thinking about, and we are having our learning issues. We are trying to find out our own solutions. So that way, they train the students how to go about that. So the aim is not to cover entire syllabus as a syllabus is only very compact one. So few cases or few aspects are discussed during the problem-based learning.
Correct, madam. Thank you, madam.
Thank you, sir. Thank you.
Okay. So I am making Dr. Princy the presenter again.
Yes, sir. Yes, sir.
Yeah. So we go to the next competency here, and we have the pharmacology competency 5.2. Here we see we have to communicate. Oh, wait. This one, who would like to give their? This is coming in small group learning.
It has not come yet, ma'am. It's just coming.
I'll just share. My screen is not sharing.
I'll send you the link again.
No.
Can you read it loudly? I think
Yeah,
that is this
Have
is
you
the
pressed?
past. Just read it out.
Yeah, I'll just do that.
I have already sent you the link again, Dr. Princy.
No. Just share my screen is not happening.
Yes. Just click that. Click the share my screen button.
Yeah,
It must have appeared on your screen.
it is. I mean, clicking on it. Are we?
Not yet.
Yes, ma'am. Yes, ma'am.
Has it come on anybody's screen?
Is it
Not
not?
on mine.
Sir, I think it's the old screen which is being shown now. It's not Dr. Princy's screen.
Dr. Princy, you have to. Yes, it has come now.
Yeah, it has come. No?
Yes.
I mean, the net takes a little, so there is some lag sometimes.
Yeah, 1 minute, please. Yeah. So now we come to the competency 5.2. It is communicate with the patient regarding the optimal use of drug therapy device, that is A, B, C, and that is the storage of medicines. So how would you like to do this? How would you like to do this? Do we have any takers?
I'm lowering all the older hands, and so if you want to speak, you raise your hands again. Yes, Dr. Chandrasekhar.
Hello,
Yes, go ahead.
ma'am. Optimal use of drug device and storage of medicines. See, the thing is, first of all, you should understand like present what's there in our institution and working institute. What are the equipments or what are the medicines or what are the devices are there. Based on that, we should teach our students as per my knowledge. But if the university of it is the college is the different thing. first of all, you should understand what are the things are there in their own institution. Suppose if you are teaching the students all the guidelines and all, but the present institution is not having it, very difficult for the students to understand what the devices and what the drugs what they have in their institution. So for that specifically, what are the communication means, first you should understand what are the protocols of their respective departments of the medicine, surgery, OBG, pediatrics, or the dermatology. What are the medicines they prescribe, or what are they follow the guidelines. From that guidelines, we should tell the students the communications and all, as per my knowledge.
Mhm. Okay. Could anyone else give another aspect of this? How would you like to take a small group discussion on this topic? This is
Ma'am,
a
can I?
mandatory one. Yes, go ahead.
I think, ma'am, this can be done with the help of a role play. We can ask the students to act as a volunteer. First we will have a small session on this. We will tell the protocol. We will tell about the part of devices, how to have used. Yeah, they can go for small self-directed learning, and then they can go for a role play where a student can act as a patient, and one other student can act as a doctor, and he or she will communicate with the patient how to use a particular drug which has been prescribed to him. Another can tell about supposing like an inhaler, and another one can tell about how the medicines have to be stored. So according to me, the best will be role play.
Yeah, very well said. That's another way of doing it. Do we have any other method? Any other method?
Dr. Lavanya Bina Nayak.
I'm Dr. Naveen here. My wife's account I'm accessing. Hello.
Yes, go ahead.
Yeah, madam. Actually, I wanted to answer this 5.2, but already previously one of the attendees she said the same thing, that it's a role play.
Okay.
Madam, other one is, I have one other doubt. You said that in a small group teaching, panel discussion and what you call symposium, are they small group teaching?
No. That's what we can bring it out into a small group also. Symposium and panel technically comes in the large group discussion. That's what we have in conferences. Yes, maybe bring in experts, but for integrated teaching like nesting, or you want to do coordination, temporal coordination, correlation, those aspects can be done even in a small group discussion, for which you can use symposia, and you can adopt it into the small group.
Then if at all it is a panel discussion, who will be the panelist?
You could have the students talking about, say, what are the indications, what are the ADR, all the different aspects of, say, anti-asthmatic drugs or something.
So, madam, to become a panelist, students as a panelist, have to learn by themselves, like self-directed, or should we teach them
Yes.
through some other
It is
way of?
lecture, small group learning, small group discussion. That's how it is being given.
Okay, madam. Thank you.
Yes, sir. Thank you so much. Anybody else would like to tackle this?
Can I ask a query? Pravina here.
Hello,
Yes,
madam.
go ahead.
I'm
Speak.
Dr. Bhuwana.
Yes, Purna.
I just wanted that, like devices, we can use this meter dose inhalers, insulin pens. We can teach them, we can have a standardized patient and teach them about these devices. Regarding optimal use of drug therapy, we can use, for example, oral contraceptive pills. Then we can go about teaching them how to take steroids and how not to discontinue it.
So So all that is a type of communication.
And
So you can have
coming to storage of medicines, or
Mm.
insulin has to be stored at this one in a refrigerator or at a room temperature in cold water or ice pack. Those things can be communicated to the patient using a standardized. That means we can use a standardized patients.
Right. That is also right. Very well said.
May I ask a query, ma'am?
Yes, go ahead and ask a query.
Hello. Yeah, madam, this particular
Yes.
competency, I don't think we can we teach it at a particular time frame. It has to be split across the year, I think, because I
Okay.
think insulin pen will have to be taught when we finish with diabetes in the class, or a suppository will have to be taught after when we finish with GIT, or meter dose inhaler after we finish respiratory system. So all these topics will have to be will get split as and when we finish the topics. It won't be at a stretch we sit down and finish this competency. And I think this has to be done after we finish with the competency. There's a competency on drug formulations.
Yes.
So once we finish that, then we go ahead with communication in different bits and pieces across the year. It cannot be in one point we finish with communication of all the devices and all the drug therapies.
That's also very well said. So the whole crux of the matter is to repeat. You know, so we are taking it first when we talk about drug formulations. Then you can have it again, and you can have it systemically when we are taking each system, and then the insulin pen comes when you're doing diabetes. Yes, it'll come. So you're reiterating, and that is the reason why a student will be able to remember. So you have to tell them at different times, and the learning according to their prior knowledge goes on increasing. It's a stepwise development, progressive infusion of knowledge. That is what we are doing in CBME. So this is how we look at various, I think as we are coming down to the time frame, I would just like to, very good queries and very good answers to all these hands-on session that we did. We are now aware of how to use it. So when we are using this small group discussion techniques, we can innovate, and we can be, you know, very effective and learning, and also part of evaluation you should use. Like sometimes when and you should be, as a teacher, you should be always unpredictable, you know, that keeps the suspense, and students never know what's going to happen. And actually, not always, but once in a way, it is nice to be unpredictable. So I suddenly put a Kahoot. I take Kahoot, and then they are answering a quiz in my tutorials. So that puts them all in a mood, you know. So that's how you can spice up your small group discussions. Use a myriad of techniques and use it within your logistic perimeter. That is, within your number of staff that you have. Like Sir said, definitely we have 30 students coming as a batch, and then we can divide them. And even one single or two, three teachers, including our residents, are being used up for this, because we don't have too many. So we as a staff, we brief ourselves so that we can take this how it is expected to go, and that's how you can clear up the logistic difficulties that you have of inadequate staff. So friends, I think we can end this session, and with the concluding remarks from Dr. Nirmala Rege and Dr. Khilnani, I would like to close this session.
It was a very wonderful session. Means, I joined a little late, but I could get, I think, most of the things. And the strategies we have shown in the small group teaching, and followed by this competency, and you asked participants how it can be communicated to our students. That was really marvelous, because from the participants' response, we can say that there could be different ways in which we can same competency can be taught to the students. One thing I feel we have to remember, especially related to that last competency, Though it is nice to have it again and again at different, you have to think about the time available for you, whether it is possible, or you have to make a list. It is not necessary that they should know the use of all the 1,500 drugs in the book. You have to decide how many you can want them to learn. It could be 10, 15. You have to give them the approach for that. So select those drugs, as madam said, that select the devices related to the pharmacology drug delivery system, and then you can train your student and take, there has to be practice. So it could go for 3 or 4 sessions in a year. You can't go beyond that, according to me. So think about it. But it is a very nice way of the way in which madam has shown you, Princy madam has shown you, how to go about the small group teaching in when it is incorporated in our curriculum. Thank you. Dr. Khilnani?
Yes. So, in nutshell, small group learning is a student-centric approach where students actively act and interact, and teacher or a tutor acts as a facilitator. Now, a large number of topics are there in the competency table where small group learning or small group discussions would be required. Since it is a group, it follows the group dynamics, and we must always follow those group dynamics to make it a coherent initially at least. Most of the skill sessions, most of the small topics would require such learning. I think Madam Princy has given a vivid approach, types and methods of small group discussion and learning. Thank you, Madam. Thank you all.
Thank you all. Good night.
Thank you,
Good
Sanjay.
night.